Dr. Lippman.
Thank you, Chairman. So in tab 2, first of all, we are saying goodbye to four of our members today. And it's actually all 4 of our members representing county government who have chosen not to seek re-election and will be leaving us later this year. You may have seen we've already taken photos with the 3 who are here today. First of all, I just want to say we can't begin to express our thanks to these members and for their service to the commission. And actually, not only are we losing their service, but 2 of them are the 2 longest serving county mayors in the state of Tennessee. I believe Mayor Waters is the longest serving and County Executive Huffman is the 2nd longest serving. So it's Tennessee's loss as well. But just want to thank them for their service to the commission and also to the people of Tennessee. Just a little bit of biographical information. We do have the proclamations. Okay, we do have the proclamations that are in your docket books, but just a little bit of brief bio information. Mayor Rogers Anderson, who's not with us here today, but he was first elected county executive of Williamson County in 2002 after serving on the county commission for 16 years. He served as a board member of the Workforce Development Board and the Tennessee Veterans Home Board, among other roles, and is a veteran of the United States Air Force. He was first appointed to TACIR in 2006. County Clerk Mary Gaither, who you will recall we said goodbye to at our last meeting. We also have a proclamation for her. She was first elected Tipton County Clerk in 2010 and has served as president of the Tennessee County Clerks Association and as a board member of the County Officials Association of Tennessee, among other roles. She was first appointed to TACIR in 2019. County Executive Jeff Huffman, Tennessee's 2nd longest serving county mayor, was first elected county executive of Tipton County in 1986 after serving 8 years on the Tipton County Commission. He has served as a board member on the Delta Human Resource Agency and the Aging Commission of the Mid-South, among other roles. He's TACIR's longest serving member. County Executive Huffman was first appointed in 1994. So the only person here who's been here longer than me is now leaving.
And he looks old.
Mayor Bob Ryle was first elected mayor of Dixon County in 2010 after serving on the Dixon City Council for 7 years. He has chaired the Mid-Cumberland Human Resource Agency and the Tennessee Association of County Mayors, among other roles. He was appointed to TACIR in 2023. And then Mayor Larry Waters, Tennessee's longest serving county mayor, was first elected county executive of Sevier County in 1978. He has served as president of the Tennessee County Services Association, chaired the Tennessee Development District Association, and served as vice chairman of TACIR, among other roles. He was first appointed to TACIR in 2008. And I believe Chairman Yeager also wanted to share some words on these departing members. There it is.
All right. I think that may be a little bit better. I really appreciate your letting me make a few remarks here today. I wanted to more of a personal nature because I've served with the clerk and the 3 gentlemen in many ways over the years. And Mr. Ryle is here, Bob Ryle. I've had the privilege to know you for a few years now, and I really appreciate your conscientious effort, what you've tried to do as a mayor of a growing county over there in Dixon, Tennessee. That's a fast-growing county, and there are a lot of issues you have to deal with, and you've done very well. And your conscientious effort and your contributions to this body. And then Jeff Huffman and Larry Waters are 2 mayors that I've served with for many, many years. When Larry was elected, he is was it the longest serving or the oldest county mayor? I don't remember. Or both? Actually, Larry and I went in together. He was elected county executive, which is what they called him back then, in 1978, I believe. And I was elected Roane County attorney that year. So he's always lorded it over me that he served 1 more term than I had at that time. But I've had the privilege to serve with Larry. He's Sevier County, which has experienced phenomenal growth during his tenure in office. And they've also have endured terrible tragedies, for example, the fire in Gatlinburg. And through all of that, the good and the bad, he has exhibited steady, good leadership and kept the county together and the morale of the county intact. And I'd invite any of you to go over there now and you can see the progress they've made as a result of his leadership. Jeff Huffman is another one that is a longtime friend of mine. We've served together for years as well. And I really appreciate his interest in the details of county government. He's a hands-on guy, and we'll miss his comments here because whenever, what is it, to paraphrase an old commercial, whenever Jeff Huffman speaks, everybody listens because he knows what he's talking about. But I just wanted to offer some personal comments about my friends, these three gentlemen, and Mary. We will miss you, but it's a bittersweet moment for us. We will miss you, but we understand, and frankly, we might even envy you a little bit. So thank you, Mr. Chairman. Mr. Director, excuse me.
Thank you, Chairman. And before we move on to the next tab, we also do have a staff update. We are pleased to be joined in our work by two interns this summer. Hayden and Omar, could you stand, please? We have Hayden Phillips and Omar Watkins. Hayden earned a Bachelor of Science degree in Political Science from the University of Alabama and is enrolled in Vanderbilt University's Peabody College, where she is pursuing a Master of Public Policy degree. Omar recently graduated from Tennessee Technological University with a Bachelor of Science degree in Political Science and has been accepted into the Master of Public Policy program at the Baker School of Public Policy and Public Affairs at the University of Tennessee. So we're delighted to have them working with us this summer, and we're going to keep them very busy. Thank you.
Our next item on the calendar would be under tab 3, the work program accomplishments, amendments, and new research plan, which will be presented to us by our Deputy Executive Director, Melissa Brown. You're recognized, Deputy Executive Director. Yes, Cliff.
While Melissa's getting set up, I did want to let the members know that we do have a public comment that's included in your docket books related to one of the work program items. It's a written public comment from a Mr. Peter Maher, and so those are included in your docket book. It's related to our study on public notices, and the staff has already filed this in our with our research material, and it will be part of the public record for this study. Thank you.
Continue, Ms. Brown. You're recognized, ma'am. No.
Here we go. Can you hear me now? Okay. Thanks to whoever did that. Thank you, Mr. Chairman. Good afternoon. Well, good morning. Good morning to everyone. Again, my name is Melissa Brown, the Deputy Executive Director at TACIR. This morning, I'll be reviewing the information behind tab 3 in your docket book. This is when we take a look back at the last fiscal year to see all the accomplishments of the Commission. We look at suggested amendments to the work program for work over the next year. And we also include, for each of the proposed studies, you see subtabs at the back. They're labeled A through G. Those are draft research plans for each of the proposed projects. Included there is a little bit of background that we've been able to gather thus far for each of the projects, a timeline, the due date, if there is one specified for the project, and a copy of the public chapter that directs the study. And this year I specifically say public chapter because each of the studies you're considering today comes with a public chapter attached. So it was passed by both chambers of the General Assembly. So going back to page 1 of the memo, we're going to begin looking at the accomplishments. For this portion of the memo, there's no action required by the Commission. This is for your review only. All of this information will be included in the biennial report, which is due next year, and it will cover fiscal years 25 and 26. Page 8 begins the work program amendment, which we'll go over in a few minutes. So first, we'll consider the status of existing work program projects. The Commission has 7 recurring mandates. In this section, there's a subheading for each of the requirements included in the section. is either the statute or the public chapter that requires this work, along with a brief update. First is commission meetings, which of course you hold. Next, at the bottom of page 1 is the calculation of education fiscal capacity. Going on to page 2, you'll see that the model for the fiscal year 27 has already been calculated and transmitted to the State Board of Education, the Department of Education, and the Controller of the Treasury. The next model will be due May of 2027, and this is for use in the Tennessee Investment in Student Achievement Funding Formula. Later this morning, you'll be hearing from Research Associate Ismail Tanwi, who will give you an overview of this year's model. Next is the Public Infrastructure Needs Inventory, known as our infrastructure report. You approved this year's report at your February meeting. Staff worked with 144 school systems, all the counties and municipalities, and 242 other entities to gather this information to give us the most comprehensive view of infrastructure needs in the state of Tennessee. Staff continues to gather and check survey data for next year's report. And we would like to thank all the efforts of the development districts and their contacts to gather the most comprehensive data that we can for this report. Next is monitoring Tennessee's Growth Policy Act, required by Public Chapter 1101, Acts of 1998. The requirement is to monitor the act, and this often takes the form of tracking any legislation that would affect that act and responding to inquiries from local government officials or members of the public. Next is the Electric Generation and Transmission Cooperatives Act. This is our annual TVA pilots report. At the bottom of page 2 and going on to the top of page 3, you'll recall that you approved this year's report at your February meeting. The next report will be presented in January of 2027. Taxes. So this is monitoring of Public Chapter 341 Acts of 2023, which passed in response to recommendations in one of your reports. And based on the commission report, the General Assembly has simplified reporting for small businesses, hoping to alleviate some of the itemization of their tangible personal property. Research Director Michael Mount is going to be presenting our first periodic report on the effects of this act later at today's meeting. And finally is the biennial report, which I've already mentioned is due next year. Over the past year, you published 4 studies that were either requested by the General Assembly or by members of the commission. Today, you will be considering, I jumped ahead, I'm sorry. Behind the memo is a one-pager we call the TACIR Insight. So it's a summary of the study, the background, and a summary of the findings and recommendations from that report. So for your convenience, those are located at the back in case you have any questions. And also, as each report is approved and posted to our website, we post the TACIR Insight as well. So the reports released, in addition to those required by statute on a recurring basis, was a report on district attorney staffing needs and municipal courts of concurrent jurisdiction. There was one on reducing Tennessee's evidence backlog by expanding forensic crime lab capacity. There was a study of assessing juvenile detention capacity in Tennessee. And then finally, one on improving Tennessee's continua of care with flexible funding, better data, and greater collaboration across the state. As part of the presentation of tab 4, which is the legislative update, Dr. Mike Strickland will be reviewing any legislation that passed related to any of these particular studies and other past TACIR studies. You have 5 ongoing reports that remain on the work program. You'll be hearing 2 of those reports today for your review and comment, and you'll hear 2 for your final approval. There's one other report that is still in process and will be presented at your next commission meeting for approval. Because you're going to be receiving detailed presentations from each of the research teams today, I'm just going to name these projects. The first is the transportation draft for review and comment, where we're looking at sustainable funding sources that meet Tennessee's future transportation infrastructure needs. The next report today for review and comment is a study of ambulance services in Tennessee. Middle of page 4. For final approval today is the report on speech therapy, and then the report on cosmetology and barbering. The one report that we'll be taking up at our next commission meeting is the report on real estate fraud. In addition to recurring mandates and requested studies, staff provides research support This takes the form of responding to requests for information from members of the General Assembly, legislative committees, other state agencies, local governments, and members of the public. Beginning on page 5, we note the number of presentations that staff has made to outside groups over the past year. You're going to see that Hannah Newcomb had quite the level of participation engaging with outside groups this past year. She first presented what is TACIR, Public Policy Impacting Tennessee's Child Care Industry, to MTSU. She also presented Juvenile Detention Challenges in Tennessee to the County Technical Assistance Service Annual Conference. Dr. Lippard presented to MTSU regarding infrastructure and economic competitiveness. He also presented an overview called Fiscal Capacity 101 to the TISA Review Committee. Madison Thorne recently presented regarding our infrastructure report to the County Service Association's Legislative Conference. And finally, Hannah presented again recently, assessing juvenile detention capacity in Tennessee to the Tennessee Commission on Children and Youth. Staff also works with a number of groups and agencies. Our infra team and our admin team puts together a training workshop with the development districts every year to provide training and respond to questions regarding the infrastructure inventory. Dr. Owen serves on a few task forces with the Department of Economic and Community Development, including their Digital Opportunity Task Force and 2 sub-task forces. One is the Digital Opportunity Series, and the other is the Infrastructure Series. Dr. Lippard began serving on the TISA Review Committee this year, and Dr. Mike Strickland began serving on the Interagency Housing and Health Task Force. We continue to enhance and improve our use of technology for public information. We distribute all of our reports publicly. We have focus sections on our website for ongoing studies. Our IT department and our infra team this year worked very hard to implement procedures to improve data integrity and streamline the process of bridge projects that appear in the infrastructure database. And I want to give a special shout out to Teresa Gibson this year for all of her work. She's our web developer, our website manager, oversees all of our work, all of our publications process. We've been trying to work to get into compliance with the American with Disabilities Act regarding digital accessibility. She has participated in numerous trainings throughout the year, worked with other state agencies, and trained our staff to bring us along as much as we can to be as accessible as possible. And though the requirements have been full compliance has been postponed until next year, we continue to do as much as we can to make our materials as accessible as possible. So many thanks to Teresa. Going on to page 6, so just highlight a few things here. We continue to provide weekly economic updates to our commission members and post them to our website. We continue to use social media through Facebook and LinkedIn to highlight recent studies, works of interest, and relevant research of other organizations. And we continue our contract with MTSU related to the Tracking Tennessee's Economy website. Our administrative staff is equally as busy. They've administered 11 contracts over the past year, 9 with the development districts related to the infrastructure, information collection, and database. MTSU's contract on the Economic Indicators website. And then we have a contract with the University of Tennessee related to our transportation study. And the team will be talking a little bit more about that and what that work entails, and will show when they give their presentation. We continue to encourage professional development and ongoing learning, and that is through our in-house training program. But it's also professional connections, and this is through the attendance of conferences like Think Tennessee Policy Forum and conferences of the Tennessee Municipal League and the Tennessee County Services Association. That's a very quick review of all the work that you've overseen over the past year. Lots of new studies have already started, which we can go over in just a moment. If you have any questions, let me know. And Mr. Chairman, we can move to the work program amendment when you're ready.
Let's see if there are any questions about the report you've just concluded. Members, are there any questions or comments you have? I see none, then we will move on then to the work report.
Okay, thank you, Mr. Chairman. And this begins on page 8 of your memo. And as I said, there's one amendment for your consideration, but there are, I believe it's 7 studies. They were all sent to us by public chapter. So they each passed both chambers of the General Assembly. So the first study, excuse me, is Public Chapter 1103, Acts of 2026. And it also includes who sponsored the original legislation within each section. But I'll just note the public chapter for now. This is a study of Tennessee Emergency Communication System. The associated research plan for it is behind tab A, if you're interested in taking a look at that. The due date, there's specific questions we've been asked to address. We have studied this topic in the past, so we've got a lead on this one a little bit. We don't have the learning curve on this one as we do some of the others. The due date for this one is January 31st of 2027. At the bottom of page 8, Public Chapter 1121, Acts of 2026. This is a look at state and local law enforcement compensation. Going on to page 9, you'll see that the due date for this study is January 31st, 2027. And there just are, again, some very specific questions to address with that study. We have 2 AI studies, artificial intelligence. The first one is Public Chapter 1066, Acts of 2026, and this primarily focuses on artificial intelligence and child safety. This one is due January 31st of 2027. At the bottom of page 9, there's a study requested by Public Chapter 976, Acts of 2026. This is a study of school-administered early childhood education programs in Tennessee. The due date for this is September 1st of 2027. On page 10, Public Chapter 1137, Acts of 2026. This is related to public notice, and it's a look at whether newspapers of general circulation remain the most efficient and effective manner for governments to provide the public with transparent and accessible information. There's several items to address in the bill. There's no specified due date for this particular report. At the top of page 11, there's a study requested by Public Chapter 967, Acts of 2026, which is a study of Crime Stopper programs in Tennessee. There's no due date specified for that study. And I believe the last study is our second artificial intelligence study. It's requested by Public Chapter 1082, Acts of 2026, and it's looking at artificial intelligence. I cannot speak. I'm so sorry. Artificial
You're doing just
intelligence.
fine.
Can I just say AI at this point?
You certainly may.
Thank you. I'm sorry. And the economic impact and regulatory framework for that. And with that, that is all the amendments or all the studies for consideration. It's one amendment, but 7 studies.
If I may, if there's no objection, I have one question. The 2 reports regarding AI,
Yes, sir.
do they complement one another? Are they a little redundant there? Are they looking at the same issues? How do you handle the separate reports like that on the same subject?
Well, I think it's going to help us streamline future commission meetings because one of our initial plans is to have a panel, a stakeholders panel at our next meeting, and it would hit on topics that are contained in both of the studies, the current one that's related to child safety. But in talking with the team and talking with Director Lippard, it looks like the 2 studies build on one another, that there's not redundancy there.
All right, thank you.
And I'm looking at the team leads. Hold on. They're nodding in agreement. Okay.
Do the members have questions? Commissioner?
Thank you, Mr. Chairman. On the same topic, those 2 AI studies, just a couple of years ago, the General Assembly set up the Artificial Intelligence Council and does a lot of research and work on policies that would be helpful in the state. And I would just encourage you to coordinate with them on things they've already done, but also it'd be great to pull all of that together so both entities are pulling in the same direction on that.
Thank you, Commissioner. Yes, and that's part of the plan. I believe team members have already been assigned to review all the materials and have begun reaching out to members of that council. I know we've spoken with you just for some initial conversations, but staff continues to reach out to learn about the work thus far. And Dr. Lippard has encouraged us not to replicate anything, to build on what the work that's already been done.
If I may, Mr. Chairman, real quick. Yeah, thank you for that. And not just the things that's already been done, but maybe if we work together to get the work done that needs to be done so that we actually accomplish more pulling together.
No,
I think that'd be great. Thank you.
Yes, thank you, Chairman. A couple of questions. One on the dispatch. On page 2, you talk about how the fees are distributed. Could we also take a look at the number of agencies that they must answer for? So for instance, if you have 3 separate centers operating in your county, one city may only have a couple of agencies that they're handling. And the county, for instance, in Anderson County, our county dispatch is dealing with 13 to 15 agencies. I say 15 if you want to count, 2 of the cities, their fire and police separately. So if we could look at that as a factor as well, because I think currently that's not taken into account in how those fees are separated.
Okay, and I've looked at the team director who has nodded yes, and I think we can include that as an expansion of the look at the organizational structure. It's not just how it's set up, but everybody that has to be served. Would that get at your
Yes,
question? Okay.
Yes, I believe so. Also, I just wanted to ask a question since we got the written public comment, some of the issues that were raised in there. Is that something that you intend to take a look at for the public comment study? Is it relevant? I don't know if you got a chance to look at what we received in writing. They raise issues about digital and some of the newspapers of record actually operating the digital programs for governments.
And I would say yes. I think that would be encompassed by the study. I'm looking back to the director and getting the nod. So yes, anytime we receive comments like this, we'll consider the issues
Okay.
and try to address them as part of the study.
Okay, thank you. And then lastly, the the Crime Stoppers. I don't know a lot about this, and I guess a couple of questions I just have are if we're going to support them more from the government side of things, how are issues like due process handled, or if something is reported and never acted upon, if we could just maybe as part of that study learn a little bit more about that side of things.
That's an excellent point. I happen to be somebody on staff who remembers when Crime Stoppers launched, probably in the 1980s. So I'm fascinated that we have this study. And we've already looked at that a little bit. Some of the stakeholders we've already had interviews with. It's, how do you make this referral? Do you ever get feedback? So I think some of the issues you're raising are part of that. And so, yes, because they're not currently supported by government funds, they're all set up as nonprofits. So right now we're just trying to, because what we're looking at is the history is there was a big push roughly in the 80s and lots of them developed and then some of them sort of went away.
Right.
So finding out how many are actually active right now so that we can talk to them as part of what we're doing. But yes, those are questions we'll absolutely roll into that.
Thank you so much.
Are there other questions?
And we will need a vote on adding these
Yes.
to the, okay.
If there are no other questions, then we will need a vote to approve the report. Chaired Jeff Huffman makes the motion to approve. Is there a second? Second. Is it?
Second.
All right, from Mayor Frank. Any questions or debate on the motion? There being none, those in favor of the motion to approve, say aye. Aye. And those opposed, nay. Carries. Thank you. All right. Let's see here. Where are we? All right. Thank you. If I call your attention to tab 4, members of the legislative update, Mike Strickland, our research manager, will make the presentation, and you're recognized, Mr. Strickland.
Thank you, Chairman, and good morning, Commissioners. This is the Commission's annual legislative update, which reviews legislation that was considered in the General Assembly this year and that relates to past work of the Commission in some way. As you can see from the memo, there were bills spanning a number of different topics this year, from childcare to transportation funding. In the interest of time, however, I will not be covering every topic and bill in the memo, but will instead focus on a few highlights, largely those bills that passed. So to begin with the topic of childcare, the Commission's report last year laid out the obstacles that Tennessee families face in finding and affording childcare, such as zoning rules that limit where childcare services can operate, or challenges in recruiting and retaining childcare workers. This year, Public Chapter 980, sponsored by Senator Oliver and Representative Love, implements several recommendations from that report. The act requires that local governments have a process to prioritize and expedite the review of childcare permit applications, that initial fire safety inspections for childcare agencies be conducted exclusively by the State Fire Marshal's Office, and it permits childcare agencies as a use by right in various zoning districts, including those that permit office and commercial uses. Additionally, Public Chapter 997, sponsored by Senator Watson and Representative White, establishes 3 pilot programs for childcare assistance funded with revenues from vaping product fee taxes and fees. Public Chapter 1023, sponsored by Senator Massey and Representative Hawk, transfers reserve funds from the Federal Temporary Assistance for Needy Families, or TANF, block grant to the state's Child Care and Development Fund, up to $25 million per fiscal year. And Public Chapter 747, sponsored by Senator Powers and Representative Mayberry, exempts child care homes from the need for state licensure if they have a certificate to operate under the U.S. Department of Defense. On the subject of emergency 911 service, this is something the Commission has examined several times in the past, including most recently in 2017 with a study on funding for 911 systems, and with the new study requested this year, as you just approved. Of note, therefore, is Senate Joint Resolution 48 by Senator Massey, which would have ratified an increase in the 911 surcharge to $186. The joint resolution was passed by both chambers, but was vetoed by the governor. On the subject of housing and land use, the Commission's 2024 report on housing affordability included a recommendation that the state earmark revenues from the realty transfer and mortgage tax to support a trust fund under the Tennessee Housing Development Agency so as to make low or zero interest construction loans for attainable housing. Public Chapter 1037, sponsored by Senator Powers and Representative Sexton, establishes a pilot program for such a trust fund, which will provide zero interest loans for housing development projects in which at least 80% of the units are intended for households earning between 80 and 150% of area median income. The pilot program is to be appropriated a one-time infusion of $20 million. The same Commission report also echoed a recommendation that the Commission has made several times before, which is to grant local governments the ability to create land banks. Although no bill was considered for that exact purpose this session, Public Chapter 1130, sponsored by Senator Rose and Representative Langford, grants Tipton and Montgomery counties the authority to create land banks, expanding the list of local governments that have that as an option. Also, Public Chapter 1044, sponsored by Senator Johnson and Representative Lambert, effectively creates what is sometimes referred to as a permitting shot clock, requiring municipal and county governments to provide feedback on a development application within 30 days and either approve or schedule a hearing for the application within 60 days. On the subject of low-income housing tax credits, or LIHTC, as a Commission report in 2015 discussed, case law in Tennessee has previously established that tax credits must be included when assessing property taxes on LIHTC housing. And in light of that and the fairness and equity considerations underlying the court decisions, the Commission did not recommend excluding the value of the tax credits from appraisals. Still, housing developers have said that including the tax credits results in higher property taxes, undermining the incentive for building low-income housing. This year, Public Chapter 1053, sponsored by Senator Stevens and Representative Faison, allows the value of LIHTC to be excluded from property assessments. The law is permissive, and the option to exclude the tax credits from property assessments must be adopted by a local government's legislative body. On the subject of littering, in 2023, the Commission published its report on littering in state, which, among other things, examined the trend towards extended producer responsibility laws in other states, which place at least some responsibility on producers of goods for managing the waste that can result along with their products. The report recommended that the state create a permanent litter task force of stakeholders to develop and implement strategies for dealing with litter. Senate Bill 269 by Senator Sutherland and House Bill 600 by Representative Hale would have created the Tennessee Waste to Jobs Act, which would have required producers of goods to participate in a producer responsibility organization for recycling, reuse, and composting of certain packaging material. The bill would have established an advisory board comprising various stakeholders, including representatives of local governments, different private industries, and the Department of Environment and Conservation, but it was taken off notice. And finally, on the subject of real estate fraud, over the past year, the Commission has weighed questions around real estate fraud and how it can be prevented. Recommendations discussed by the Commission have included enhanced requirements for notaries and their record keeping, as well as possible fraud review processes for registers of deeds. Senate Bill 1707 by Senator Taylor and House Bill 1762 by Representative Gant would have required that any deed for the conveyance of real property be prepared by a licensed attorney, title insurance company or agent, the owner of the property, or a person legally authorized to act on the owner's behalf. It also would have required that registers of deeds verify that an affidavit on a deed was properly signed. Each chamber passed an amended version of the bill, but they were unable to concur on a final version. And finally, I would note Senate Bill 23A9 by Senator Ackberry and House Bill 2478 by Representative Parkinson would have created a 2-year pilot program in Shelby County in which the Register of Deeds would verify and record the government-issued identification of any person making a transfer of real property, but the bill did not pass. And so that concludes the legislative update, and I am happy to take any questions you may have.
Are there questions, members? I do not believe that this will require a vote. Thank you very much. If there are no further questions, we'll proceed to the next tab, tab 5, Public Chapter 102 Acts of 2025 on cosmetology and barbering professions. The final report for approval. Cameron Fox, a research associate, will present. You're recognized.
Thank you, Mr. Chairman. And good morning, Commission members. I'm presenting the final report on the cosmetology and barbering professions for your approval, which you can find behind tab 5 of your docket books. It was prepared in response to Public Chapter 102, Acts of 2025, which directed the Commission to study the economic impact of the cosmetology and barbering industry in Tennessee, including revenue generated through services provided and the number of jobs generated by the professions, as well as retail sales, training and education opportunities, and potential barriers to entry into the industry. The report identifies and focuses on 2 nationwide trends in the industry: overall growth and specialization. The cosmetology and barbering industry, which includes services like basic hair, nail, and skincare services, is growing both nationally and in Tennessee. Business gross sales revenue and local tax revenue from beauty supply shops, barber shops, beauty and nail salons, and barber and cosmetology schools have increased, along with license fees collected by the State Board of Cosmetology and Barber Examiners. Table 1 on page 2 shows a summary of estimated revenue, and Table 2 on page 3 shows that the number of barbershops, beauty salons, employees, and wages have all increased. Increasing enrollment in graduates at Tennessee College of Applied Technology barbering and cosmetology programs reflected growing interest in the professions and courses offered. The Tennessee Board of Cosmetology and Barber Examiners regulates the industry in Tennessee by issuing licenses for cosmetologists, instructors, estheticians, manicurists, natural hairstylists, hair braiders, eyelash specialists, cosmetology shops, master barbers, barber technicians, barber instructors, barber shops, and barber and cosmetology schools. Those wanting to work in the industry can complete either the 1,500-hour Master Barbering and Cosmetology curriculum, which authorizes them to provide most services in the industry, or by completing a separate focused curriculum that has been established for certain disciplines within the industry, such as an esthetician, manicurist, or natural hairstylist license to obtain a specialty license. Staff added additional information to the final report in response to member feedback. Information about training and registration requirements for the hair braiding certificate was added on page 18, and economic incentives available to the industry on page 32, along with clarification about waitlists at Tennessee Colleges of Applied Technology, career and technical education programs, and apprenticeships on page 27 and 28. The report's recommendation remains unchanged. While Tennessee has adapted its licensing structure to align with the evolving specialization of cosmetology and barbering professions by establishing discipline-specific licenses, the state is yet to establish a specialty license for hairstyling. A hair-specific license would provide the benefit of allowing people to focus on one service, save time and money on education and training, and enter the workforce more quickly. Therefore, the commission recommends the state establish a hairstyling license focused only on hair-related services that require fewer hours of education than the existing cosmetology and master barber licenses. I'm happy to answer any questions at this time and conclude by asking for your approval of the report. Thank you.
Are there questions? Oh, Representative Parkinson, you're recognized.
Thank you, Mr. Chair, and thank you so much, and thank you to the team at TACIR for all of their incredibly hard work. I do have a couple of questions, though. What's the percentage of licensed individuals that are self-employed versus those that are underemployment?
So because the data that we received was from BLS, which doesn't factor in self-employed, we cannot determine the exact percentage necessarily of self-employed people in the industry.
Okay, thank you for that.
Continue, Mr. Parkinson.
Thank you, Mr. Chair. And the reason why I was asking that is because I think that if we're basing all of the data and information off of the professional BLS, or that we may be missing a large chunk of the amount of revenue that's being generated, because I would estimate that about 90% of the individuals that are licensed in our state are not employees of a barbershop or a salon, but are self-employed and business owners, or rent a booth from a salon or a barbershop that they contract just for that booth space and generate their own income as a business itself. I also, in regard, I'm sorry, Mr. Chair, can I continue? Also in regards to the braiders certificate, we certify braiders to operate commercially. I know there was some discussion in that where individuals said, we're licensing them or regulating them for something that they naturally do. But the certification is not for individuals that's braiding their hair, braiding their relatives' hair. It's for individuals that are going to be braiding commercially and generating revenue as a business in our state. And that I can't remember where that number is, the number of licensed or certified hair braiders. Here it is. Since we passed that, 5,794 individuals have been certified as hair braiders in our state. And so my question is, being that there is really zero regulation around the certified hair braiders who braid professionally and for commercial purposes to make money from the public, was there anything considered in regards to how we capture that tax revenue, or how we ensure that they are operating from a business standpoint, just as all of the other cosmetology professionals are?
Sorry, could you repeat your question again?
I don't even know if I can repeat the question again, but what I'm saying is, so when we created the braider certification, that was for people that were going to be doing hair braiding only commercially, and the rules and regulations around that, I don't know how we capture that information from the economic impact of the hair braiders, because we don't require them to operate in a business establishment or anything like that. Were we able to quantify what that economic impact was of those who have become certified hair braiders? Because there's almost 6,000 of them in the state, and we just passed this maybe 4 years ago.
We do not have data on that now, but I could reach out to the executive director at the Board of Cosmetology and Barber Examiners to try and see if I could find that number.
One more follow-up, Representative.
Okay. And I appreciate that. I would assume that they won't have any economic information either because there's no way to capture it. So and that's the point I was trying to make, is that, we need to shore up, how we view or look at, those that are being certified to operate publicly and commercially in our state in regards to being a certified hair braider in our state. But I do want to point this last thing out too, is that, more businesses, based on this, 29.6% of those businesses are those licensees that are trying to think about how, what's the best way to say this. Let me do this instead. At Tennessee College of Applied Technology, was there any conversation in regards to the wait list that they have? Because it looks like the barber and cosmetology programs increased by 66.5%, based on what we're looking at in this study. Was there any conversation in regards to how long people are having to wait in order to get into a TCAT for these disciplines?
So when we spoke with TCAT representatives, they told us that the term waitlist is a bit of a misnomer just because at TCATs, waitlists are kind of fluid. So if, say, and this would go for any program at TCAT, but say someone was a senior at their high school and was going to enroll in a TCAT in the fall, like they would be considered on the wait list. But even with that, I think the average time they said for individuals that are on this sort of non-traditional wait list, it would be around 6 months. That would be the longest anyone would tend to have to wait. And TCAT has continued to establish new cosmetology and barbering programs based off of needs assessments that they've performed to kind of pinpoint where demand is. So they've established two just this year in new areas of the state to kind of keep up with that demand.
Okay, thank you.
Are there other questions from the members? Are there other questions? If I may, I'm having a problem trying to identify the issue here, and to try to illustrate that with this comment is our recommendation a solution for looking for a problem?
Rather than, I would say, a problem, the recommendation that we're offering is more of a means for an individual who is looking to only pursue hairstyling as kind of the service that they want to provide. This would be a means for them to do that, because currently to obtain the training for hairstyling services, it falls under the full master cosmetology license.
Are there other questions? Oh, let's see if there are others waiting first. Are there others? Representative Crawford.
Thank you, Mr. Chairman. My question is, if we create the licensing process for the hairstyling, are they going to be able to use chemical products on hair, or will they be restricted from doing so?
This would include chemical use of chemicals and styling. So yes.
And the reason that we're creating this is to allow them to get through the school and get their license at a cheaper price and less hours. That's correct?
Yes. So if if an individual knew that they only wanted to do hairstyling rather than having to complete the full master cosmetology or full cosmetology license, they could do this.
Mr. Chairman, one more question, please. I would have a real concern over that for the simple reason, if they're putting chemicals on people's heads, that concerns me that they would not be trained up to the level of where the other barber and stylist, where they're at, so.
So part of breaking out the license would allow from the full cosmetology license for hairstyling would allow for the individual components of the hairstyling license that they're practicing within the full license to be upped. the proportion of hours could be changed and increased since it would specifically be for hairstyling. So they would have more time to be able to practice
Thank you.
things such
Thank
as
you, Mr. Chairman.
mechanicals.
Thank you. You're welcome, Representative. Are there other questions or comments from the members to our presenter today? Well, if there are none, then this will require a vote to approve the report. Representative Parkinson, you can bring the curtain down on the debate.
Thank you, Mr. Chairman. And to Chairman Crawford's point, I think that more context is needed in regards to this new license that's being recommended. If you go to a full cosmetology school right now and you go for 1,500 hours, going to that full cosmetology school gets you licensed in aesthetics, manicuring, hair, and I feel like I'm leaving out another discipline. Yes, and when with this license, this new recommended license, it will focus only on the hair part, eliminating the manicuring, the aesthetics, and whatever the other license was in the master cosmetology program, which in turn justifies reducing the hours for the individuals that are seeking the hairstyling license only, and also reducing the cost to the consumer who wants to get that hairstyling license so they don't have to go out necessarily and get a full federal loan to go get the full cosmetology license. Am I correct in that?
Yes.
Okay, and I hope that just brings a little bit more context to it. So it actually saved the individuals money and time and get them to work faster, just like we did with the natural hair, aesthetics, lashing, so on and so forth. Thank you, Mr. Chairman.
Thank you, Representative, and I appreciate your comments. It does bring a little bit more clarity to the issue. Are there other comments any other comments or questions? There being none, then Chair will entertain a motion to approve the report from Representative Parkinson. Is there a second? Is there a second from Commissioner? All right. Any other questions on the motion? Did you have a question, sir? I'm sorry. Those in favor of the motion then will say aye. Aye. Those opposed will say no. The motion carries. Thank you. Our next item is item 6 of Republic Chapter 416, the Acts of 2025, Speech Therapy Services. This is a final report for approval. Jennifer, am I saying it correctly? Arzate, am I saying that correctly?
Arzate.
I was incorrect. Thank you for telling me. Arzate, our Senior Research Associate, you're recognized for presentation.
Thank you, Mr. Chairman. Good morning, Commission members. My name is Jennifer Arzate, and I'll be presenting on the Commission's final report on speech therapy services for your approval. You can find a copy of the memo in the final report under tab 6. This report was prepared in response to Public Chapter 416, Acts of 2025, which directed the Commission to study the feasibility and effects of implementing the changes to insurance coverage for speech therapy services included in Senate Bill 231 by Senator Akbari and House Bill 296 by Representative Love. As originally filed, the bill would have required state insurance plans, including the State Group Insurance Program, Affordable Care Act plans, or ACA plans, TennCare and Cover Kids to cover speech therapy services for both habilitative and rehabilitative stuttering therapy without age or visit caps or utilization review requirements. Provisions within some insurance plans, including utilization review and visit limits, may result in interrupted treatment, limiting progress and affecting individuals who need consistent therapy. By eliminating utilization reviews and visit limits, the bill would have reduced the likelihood that insurance claims would be denied, reducing direct out-of-pocket costs for individuals receiving such services. Despite the original bill's potential benefits to individuals seeking therapy for stuttering, the policy changes proposed in it do raise some concerns. In particular, there is no comparable therapy service or similar condition that is exempt from utilization review. Insurance companies use utilization reviews like prior authorization and medical necessity, not only as administrative tools to control costs, but also to ensure policyholders receive consistent, medically appropriate care. Removing these reviews could potentially lead to higher and less predictable costs, increased risk of overutilization, reduced oversight and accountability, and greater variation in care that may ultimately affect premiums, public spending, and equitable access to services. In addition, under the Affordable Care Act, each state selects an essential health benefits or an EHB benchmark plan that defines the minimum coverage required for ACA plans. If a state mandates benefits that exceed those requirements and increase costs, the state must cover those additional costs, a process known as defrayal. So as originally filed, the bill would have triggered defrayal, meaning that Tennessee would be responsible for making up the difference that would otherwise be federally subsidized. Because of the concerns involved in eliminating utilization reviews and making legislative changes to minimum coverage standards for ACA plans, the report's final recommendation remains unchanged. Rather than eliminating utilization review, the report identifies a more targeted and cost-effective approach. There is an existing administrative process through which the state can update its EHB benchmark plan and, importantly, avoid defrayal. Tennessee's current EHB requires ACA plans to cover at least 20 visits per year for habilitative and rehabilitative services. And while insurers may choose to cover more visits, commission staff are aware of only one insurer in Tennessee whose ACA plans cover more than the minimum. Because visit limits are one of the primary reasons that speech therapy claims are denied, and because public programs like in Tennessee, including the state group insurance program 10 Care and Cover Kids, already provide coverage for medically necessary therapies with either no visit limits or higher visit limits, increasing the minimum number of therapy visits required under ACA plans would help ensure more equitable access to care. And to achieve this without triggering state defrayal costs or disrupting standard insurance practices such as utilization review, the final report recommends that the Tennessee Department of Commerce and Insurance update Tennessee's Essential Health Benefits Benchmark Plan for ACA plans to increase the minimum annual number of speech therapy visits each plan is required to cover. However, it is still important to note that selecting a new EHB benchmark plan would adopt all coverage requirements of that plan, not just those related to speech therapy. And as a result, the state should carefully consider how broader changes to essential health benefits, not just speech therapy, may affect overall cost and coverage. This concludes my presentation, and I am happy to answer any questions you may have.
Are there questions for the members? Representative Love? And then I believe Senator Campbell had her hand up too. Okay, then she'll be next. Representative Love, you're recognized, sir.
Thank you, Mr. Chairman, and to the presenter, thank you so very much for your report. And I thank TACIR for the research that's gone into this. As I stated when I brought the legislation, there are many of us who have had some issues with speech at a younger age. I myself have suffered from a type of speech impediment and have to be intentional about slowing down to make sure that I don't stutter and run through my words. And so to be able to expand some coverage to other Tennesseans, I think it's a great value. And I'm grateful for the intentionality that's gone into this report. And I think that going forward, we may find that this investment in the welfare of our children is going to benefit them greatly. So thank you again, Mr. Chairman. Thank you, members of TACIR, for that.
Senator Campbell, you're recognized.
Thank you, Mr. Chair. Thank you for this report, and thank you, Representative Love, for bringing this. If you study, if you had a speech impediment, I think it's been a net positive for you because you're one of the best orators in this body. So sometimes my LA and I talk about recording your voice to fall asleep to because it's just such a great voice. But anyway.
Was that a compliment, Senator?
Well, no, it's not because of what he says, just the. But I did want to ask, when we're looking at the state limits, explain that to me. What does, so it's a minimum number of visits required under state's essential health benefits benchmarks. And I see that we're sort of at the lower side of that. What does that mean?
So essentially, the Essential Health Benefits Benchmark Plan sets the minimum standard of coverage for each state. And typically what happens is each state selects a plan, a federally approved plan. So within this plan, you can see an example of it in Appendix D. So that's our current plan. And in that plan, it sets the standard for certain services that are covered under our insurance plans, which would be covered for the Affordable Care Act plan. So our current standard is a 20 minimum. So all ACA plans must cover the 20 visit minimum. Whether they want to cover more is up to each insurance provider. However, we have found that they will sometimes set that as the maximum. And again, we only found one that set an unlimited number for visits for speech therapy specifically.
Continue.
Yes, just one more question. So obviously, this is a problem or a challenge that requires as many visits as it requires, for people to get the help that they need to be able to overcome this. And so, is there some kind of intelligence that goes into those? Is there some kind of research that goes into setting those minimum requirements?
I'm sure there is. So it's very difficult to set a specific number simply because the way that speech therapy is treated is very individualized to the individual. So while one person might require 5 visits per year, someone might require ongoing therapy throughout the year. So it's in that sense, it is difficult to set a number. Which is why even if they were to set, for example, an unlimited number of visits, not everyone is going to use, let's say, more than 20 visits a year. So that's kind of where we're coming from in that sense. So we didn't really look into if there's a specific number because, again, it's individualized treatment.
Other questions from the members? I see none. Is there a motion to approve the report? From Representative Love, is there a second? From Representative Parkinson. Is there any further comment or debate on the motion on the floor to approve the report? There being none, then those in favor of the motion say aye. Aye. Those opposed, nay. And the motion carries. Thank you, Ms. Arzate. I will call your attention now, members, to the next item on our agenda, tab 7, Public Chapter 438, Transportation Infrastructure Funding. It's a draft report for review and comment. I believe Mr. Morio, our Senior Research Manager, will be presenting. You're recognized, sir.
Thank you, Mr. Chairman. Good morning, Commissioners. My name is Bob Morio, Senior Research Manager, and I'm pleased to present and discuss our draft of the Commission's report on alternatives for funding Tennessee's long-term transportation infrastructure needs, located under tab 7 of the docket book. The study was directed by Public Chapter 438, Acts of 2025, after legislation introduced by Senator Massey and Representative Vital, and it has a final due date of September 30th of this year. A copy of the Public Chapter is included as an appendix at the end of the draft report. Our study finds that Tennessee's transportation network, which includes more than 95,000 miles of state and local roads and over 20,000 bridges, performs well in a number of areas compared to other states, and that Tennessee ranks highly for its cost-effective management of state-owned roads. But while the state is doing well overall, population growth, tourism, and economic development are putting more and more pressure on Tennessee's road network, and issues like increasing congestion and fatal accidents are reasons for concerns. This study first asks us to identify the critical long-term highway and bridge infrastructure needs of the state. And to do this, TACIR staff relied on several resources, including data reported by local officials for the Commission's annual Public Infrastructure Needs Inventory, along with planning documents and other publications from TDOT. We looked at state budget documents, audited local government data from the Comptroller's Office, conducted interviews and corresponded with local highway officials, rural and metropolitan planning organizations, TDOT staff, and other stakeholders. I'd like to thank everyone involved so far for their assistance with this project, and add that I look forward to continuing our work with your input as we move towards the final report. The General Assembly and TDOT have been working to support the state's growing infrastructure needs and address the backlog of infrastructure projects. In 2017, the General Assembly passed the Improve Act, increasing fuel taxes and annual vehicle registration fees to help fund 962 transportation projects identified by the Act. TDOT has said that 446 or 46% of those projects have been delivered to construction currently or are completed. And of the remaining 516, 312 have begun portions of right-of-way and engineering, but 204 have not been started at all. TDOT says it has delivered 48 capacity-adding projects across rural, suburban, and urban communities since 2024. But beyond the projects specified in the Improve Act, there are additional projects estimated to cost $24 billion needed to alleviate growing traffic congestion around cities like Nashville, Memphis, Knoxville, and Chattanooga. According to one report, Tennessee now ranks 36th out of 50 states for urban traffic congestion. Another has Nashville ranked as the 12th most congested city in the United States. Another report found that 8 of the country's worst trucking bottlenecks are on interstates in Tennessee, which ties us with California for the 3rd most of any state. And even outside of cities, widening rural interstates to 3 lanes in each direction is estimated by TDOT to cost nearly $20 billion. Local governments also have transportation infrastructure needs, as they own and maintain about 85% of all public road mileage and 58% of all the bridges in the state. Last year, highway officials said counties were facing a $4 billion project backlog, and according to our recent data from Penny, counties and cities together report $11.4 billion in locally owned transportation infrastructure needs that they intend to deliver over the next several years. Public Chapter 438 directed the Commission to identify the annual highway and bridge infrastructure funding gap and the amount needed to fund the maintenance, repair, and modernization of existing highways and bridges across the state. The recently passed state budget for fiscal year 2027 includes approximately $1.9 billion in state funding towards a total TDOT budget of nearly $3.5 billion. The cost to continue investing at this level in order to both maintain the existing infrastructure and make the safety and capacity improvements needed to support the state's growing population and economy will increase annually and likely total approximately $7.8 billion by fiscal year 2055. The recurring cost to only meet the state's goals for maintaining existing pavement and bridges in minimum good condition, along with necessary department operations, is approximately $1.6 billion in fiscal year 2028, and that figure could grow to $3.5 billion for fiscal year 2055. So how do our existing sources of revenue compare to these growing expenses? Federal funding, which comes primarily from federal fuel taxes on gas and diesel, typically accounts for around 40% of TDOT's annual budget, approximately $1.2 billion a year, and federal fuel tax rates have not been increased since 1993. Tennessee's state fuel taxes account for another 30% of TDOT's annual revenue, or approximately $820 million a year. Tennessee's fuel tax rates of 27 cents per gallon for gasoline and 28 cents for diesel last increased in 2020 as part of a multi-year phase-in as a result of the Improve Act. Vehicle registration fees are the 3rd largest source of revenue for transportation funding in Tennessee, accounting for approximately 11% of TDOT's funding, or $330 million annually. These also were last increased by the Improve Act going back to 2017. So unfortunately, none of these revenue sources is keeping pace with Tennessee's transportation funding needs. The costs to build and maintain critical transportation infrastructure are increasing, while at the same time, improvements in fuel economy and the potential for future electrification of vehicles are limiting revenue growth. As a result, a gap is growing between this flattening revenue and increasingly costly needs. Over the course of the study period in this report, expenses are projected to increase annually by around 3%, while projected annual revenue from existing sources increases by less than 1% each year. In fiscal 20 year 28, the state's existing recurring sources of revenue are expected to bring in about $2.6 billion. This leaves a nearly $1 billion gap between that recurring revenue and the $3.6 billion in funding needed to both maintain the existing road and bridge network and make additional capacity improvements. So as I'm about to discuss, non-recurring funding, including transfers from the state's general fund and increased federal support over recent years, have been used to close this gap to invest more in the state's infrastructure. Page 46 of the draft report under Table 10 shows these transfers from the general fund for transportation since the year 2015, which together add up to over $6.6 billion. The report notes that although these transfers have helped TDOT deliver important projects and provide much needed aid to local governments, the state should not continue to rely too heavily on general funds to fill the gap for funding long-term transportation needs. Moving funding from the general fund pulls those resources from other state priorities, and relying on one-time transfers can also make it more difficult for TDOT to plan ahead than it can with recurring revenue. The draft report also notes that Tennessee, like all states, has seen a boost in federal funding since the 2021 Infrastructure Investment and Jobs Act, IIJA, which was the largest federal funding package for transportation passed in recent history. That act is set to expire in September of this year, at which point Congress will have to pass another funding authorization. A few weeks ago, a bill, the Build America 250 Act, was a bipartisan House bill proposing increases in funding for highways and bridges, has been approved by a House committee, but many are still skeptical that Congress will continue to provide the level of appropriations that were provided by the IIJA, or that any new authorization bill can get signed into law before September ends. So staff is going to continue monitoring that reauthorization process as this report is finalized. So what the commission finds with this draft report is that to maintain Tennessee's existing road network, the state will need to address diminishing revenue generated by existing highway funding streams by either continuing to make one-time transfers from the general fund, or through a combination of creating new sources of revenue or enacting higher rates on existing revenue sources. If the state wishes to increase the capacity of its current transportation network to remain economically competitive and meet the demands of its growing population, this need will be even greater. But as the report notes, there is not going to be one single revenue source to close the state's recurring transportation funding gap. On page 10, you'll see what is both a finding and a recommendation. It reads, the commission finds that the General Assembly could increase funding for transportation using a mixture of revenue sources, including increases to existing sources and the adoption of new revenue sources, to ensure that any tax increases are not borne solely by one group of taxpayers. Additionally, to ensure continued state support for local transportation projects, the commission recommends that any increases in existing shared revenue sources continue to be shared in a similar manner, and that the state designate portions of revenue from new transportation sources to be shared with local governments for local transportation projects. So from there, the draft report describes several revenue alternatives that could be considered as parts of the state's preferred solution. As directed by Public Chapter 438, Commission staff assessed a variety of existing and new revenue sources based on criteria that include the amount of revenue each alternative could likely generate, how that revenue is expected to appreciate over time, how closely that revenue source is tied to road use, and the extent to which road users from other states could contribute to it, along with any potential administrative challenges to implementing each of these alternatives. Later on, the report explains how strategic state borrowing and continued or increased use of public-private partnerships could also help the state expedite important infrastructure projects. Regarding fuel taxes, the report notes that Tennessee's existing fuel tax rates on gas and diesel are less than the average rates among our peer and neighboring states, which is shown on page 43 in Table 7. Our methodology for choosing the 5 peer states listed is explained on page 29. Because Tennessee's fuel tax rates are not indexed to inflation, something half of all states and several of these peers have done, the buying power of the revenue collected has been decreasing in recent years. Had they been indexed to grow with inflation after 2020, the gas tax could be 32.5 cents and the tax on diesel 33.8 cents, each about 6 cents per gallon higher than they are and more in line with the average of our peers. Increasing both fuel taxes to where they would likely be for fiscal year 2028 had they been indexed would increase state transportation funding by an estimated $191 million, with corresponding increases of $70 million to counties and $35 million going to cities. Indexing them to continue adjusting in the future could increase state transportation funding by approximately $587 million in fiscal year 2048, with an additional $210 million for counties and $105 million for cities, with the assumption of average inflation rates of 2.5%, which is something we consistently use throughout the report. We note that the General Assembly could set a cap on inflationary increases, perhaps around 3%, to limit rate changes in times of higher inflation for this or any of the other alternatives presented in the report. The report points out that fuel taxes are a source of revenue that does not come solely from Tennessee's residents, and that a fuel tax increase would be borne by both in-state and out-of-state drivers, which is one of the criteria mentioned taken into consideration. Next, the draft report looks at vehicle registration fees in Tennessee. Tennessee's flat registration fee of $26.50 for passenger vehicles is lower than rates in many neighboring states and has not been indexed to inflation either. Had the Improve Act indexed registration fees to grow with inflation, the fee for passenger vehicles would be approximately $33.50 in the year 2026. Registration fees for commercial vehicles are also not indexed to inflation, but these do vary to increase by vehicle weight classification. Increasing registration fees for all vehicle types to where they would likely have been in fiscal year 2028 had they been indexed to inflation after 2020 would increase state transportation funding by an estimated $129 million. And to help ensure that future revenue keeps pace with inflation, indexing registration fees going forward could increase revenue in fiscal year 2048 by approximately $560 million. The report notes that the state has already indexed additional registration fees paid by owners of electric vehicles and hybrids, an adjustment that is set to begin taking place next fiscal year. Because registration fees are not affected by fuel efficiency or tied to fuel use at all, revenue from registration fees is likely to appreciate as the state's population continues to grow. But any increase in registration fees for passenger vehicles would be borne only by Tennessean residents. On the other hand, drivers of commercial vehicles traveling in and through Tennessee, but are registered in other states, pay mileage apportioned registration fees, meaning that a portion of those fees would be paid by out-of-state commercial operators. Heavier vehicles have been shown to cause greater wear and tear on roadways. Currently, Tennessee charges weight-based registration fees only to commercial vehicles, but some states also apply weight-based registration fees to passenger vehicles. The report explains that if Tennessee were to apply weight-based registration fees to passenger vehicles with a gross vehicle weight rating of over 6,000 pounds, that could increase state funding by an estimated $58 million in fiscal year 2028 and $122 million for fiscal year 2048. And these higher fees based on registration data would only apply to approximately 30% of Tennessee's registered passenger vehicles. Next, the draft report describes how some states have implemented or tested the use of vehicle miles traveled, VMT taxes. These types of taxes seek to supplement or replace fuel tax revenue by charging drivers a per mile fee for use of the state's roads. Implementing a VMT tax in passenger vehicles across the board in Tennessee, however, could come with several administrative challenges. Unless other states, especially our 8 surrounding states, were to adopt similar programs, it would be difficult to apply this tax to visitors traveling to or through Tennessee. But what the report suggests could be an option is a per mile tax applied only to heavy commercial vehicles. For example, Kentucky receives approximately 5% of its highway revenue, $86 million in the current fiscal year, from a 2.85 cent per mile tax on vehicles weighing 60,000 pounds and above. There are 4 other states also charging weight-based mileage fees. So this alternative could be less administratively challenging to the extent that many of these vehicles are already reporting mileage to the state for interstate registration and fuel tax purposes, avoiding issues of personal concern about tracking and reporting individual miles. Staff estimates that a 3 cents per mile tax on tractor trailer truck mileage could potentially generate $190 million annually, roughly the equivalent of a 4-cent fuel tax increase, some of which could be collected from trucking companies based in other states and traveling through Tennessee. So far, these types of taxes and fees fall into the category of road usage fees, those that either approximate road use, like fuel taxes, or are paid by vehicle owners exclusively, like registration fees. The public chapter also asked the Commission to analyze other potential sources of revenue, including rental car fees, transportation network company or rideshare fees, and retail delivery fees. Tennessee's tourism industry is growing, and tourists and visitors are adding traffic to the state's highways and other transportation infrastructure. Currently, the state has a 3% tax on gross proceeds from rental car businesses, which generates approximately $20 million annually, but it only goes into the general fund and not the state's highway fund. Staff has estimated that increasing the rate from 3% to 5%, earmarking it instead for transportation funding, would generate $34 million in additional revenue for fiscal year 2028 and $43 million in fiscal year 2048. If you look at page 57, table 13, however, something to consider is that the combination of the state and average local taxes that are currently applied to car rentals in Tennessee is already above many of those in our neighboring states. So existing revenue could simply be directed to the highway fund instead without raising the tax rate if that were to be a concern. Several states, including some of Tennessee's neighbors like Georgia, North Carolina, and Kentucky, have begun to impose taxes on rideshare services. Georgia's tax started at a rate of 50 cents per trip in the year 2020 and was indexed to increase with inflation, currently 64 cents per trip. Staff estimates that a 50-cent per trip tax in Tennessee on rideshare could generate approximately $45 million in fiscal year 2028, increasing to $268 million in fiscal year 2048 if current trends in the growing use of these services were to continue to rise and the tax were increased to inflation. Rideshare taxes, however, would not generate as much funding as some of these other revenue sources, but could appreciate over time if indexed to inflation and to the extent that use of these services continues to increase. The report also notes that rideshare users pay these taxes regardless of whether they're Tennessee residents or visiting from other states. Some research suggests that increased use of online package delivery is a significant contributor to road use and traffic. Only 2 states, Colorado and Minnesota, have enacted fees on retail deliveries of taxable goods. While they're generating a fair amount of revenue, these fees have not been wildly popular, as legislators in both states have recently attempted to repeal them. But that said, TACIR staff estimates that a 30 cents per fee per delivery indexed to inflation like Colorado's could generate $88 million in fiscal year 2028 and increase to $159 million by fiscal year 2048. But additional revenue is not the only way to deliver infrastructure improvements. The draft report also describes how public-private partnerships and debt financing can help expedite needed transportation projects. The Transportation Modernization Act gave TDOT the authority to use public-private partnerships, or P3s, for the first time, which it is using to develop price-managed choice lanes to reduce congestion on some of the state's busiest interstates. While P3s can be effective, they rely on having a private partner willing to finance a project in return for revenue. Some much-needed transportation projects might not make financial sense for private sector partners. In these cases, strategic borrowing by the state is an alternative that could provide upfront financing needed to complete large projects as quickly as possible. Tennessee is one of the few states that does not use state debt to help fund state transportation projects, relying instead on a pay-as-you-go model, though some local governments do use debt financing for their own local transportation projects. The state's approach has allowed it to avoid long-term debt obligations, but pay-as-you-go can delay the delivery of major infrastructure projects, which, over long periods of time, could significantly increase their construction costs. The report points out that several other states with AAA credit ratings like Tennessee have used transportation debt financing while maintaining their state's top credit ratings, including Florida, Georgia, Missouri, North Carolina, Texas, and Virginia. A 2024 report from the University of Tennessee Center on Business and Economic Research said that Tennessee could feasibly and strategically increase its debt load while maintaining its status as a low-debt state with top credit ratings. TACIR staff developed an example to illustrate strategic borrowing for long-term needs, which is shown on pages 18 and 19 under Table 1. Given the potential benefits of accelerating delivery of strategically important projects and the possibility that Tennessee could take on debt without negatively affecting its credit rating, if done judiciously, the draft report's second finding is that Tennessee could likely benefit from using debt to help finance the construction of some strategically important projects that aren't good candidates for public-private partnerships. TACIR staff does not presume to know which projects might be potential candidates, and the estimates used in this analysis are not project specific. The report notes that timing of financing is an important factor in determining whether debt financing is an appropriate funding strategy, and that having a dedicated revenue stream earmarked for debt service payments helps avoid the need to divert future funding away from other needs. Draft report is only saying that strategic borrowing could allow Tennessee to more proactively fund some large projects while maintaining its top credit rating. So after all the review and analysis of these many revenue and funding alternatives, staff has presented a couple of example scenarios for the draft report to show how different combinations could meet the state's long-term needs. These can be found on pages 19 through 25. So scenario 1 increases existing sources of revenue and adopts several new sources of revenue while limiting use of the general fund. Figure 1 on page 22 is certainly a little complicated looking at first, but I'm going to go through that one with us. So starting with projected costs and needs, the first orange dash line at the bottom of the chart represents our projection for TDOT's recurring maintenance and operational costs going forward. Above that, the line of dotted markers represents projected costs to deliver the state's desired capacity and safety improvements by 2055. The bars represent revenue sources needed to meet the dash line expenses. Existing recurring state funds, fuel taxes, registration fees are the light gray bar at the bottom. There's a small dark gray bar above that for other non-recurring existing state funds. This is slowly spending the general money transferred through the general fund as that goes on over the next several years before diminishing. The other bars show combined effects of fuel tax increases, higher registration fees, newly proposed fees and taxes that have been mentioned, with projected federal dollars as the hatched bars at the top. So overall, this scenario 1 combination provides $14.1 billion more in total funding through fiscal year 2040 than existing sources would be projected to provide, allowing for more investments to be made in new projects to reduce that backlog of long-term needs. So that adjustment is shown by the dotted line at the top, where some of the later needs are able to be completed earlier and reducing those needs towards the back end. This still, however, falls approximately $1.5 billion short of the total needs over the final years of the projection. So scenario 2 makes greater use of general fund dollars to impose fewer tax increases or new taxes. This provides $15.1 billion more funding in total funding through fiscal year 2040 than existing sources are projected to provide, allowing for even more investments to be made sooner for new projects. So by spreading that spending out evenly over time, this scenario does not fall short of our projected total needs, but does require the transfer of nearly $1 billion from the general fund in fiscal year 2054-2055. If you see the table 2 or table 3, the funding sources for scenario 2, the general fund transfer starting around $447 million and growing to nearly 960. Lastly, scenario 3 adds the strategic borrowing option to the combination shown in scenario 2. This table 4 on page 25 shows $10 billion being borrowed between fiscal year 2028 and fiscal year 2037, spread out over those years to help deliver later year projects sooner. Less revenue would be available over the entirety of the period because of the portion needed for debt service, but money could be potentially be saved by completing costly projects sooner. And the state would enjoy benefits of congestion relief, safety improvements, and economic development throughout the entire period from delivering those projects earlier. With that, I thank you all for your time and attention, and I'm happy to discuss the draft and answer any questions you have.
I'm sure there may be comments or questions on this report. I will, if there's no objection, I'll start it off a little bit with a comment. I realize the charge to TACIR and to the research folks was that to look at the revenues. But there is one issue here that I think needs to be addressed. Is the time it takes to get it from the approval of a project to the begin date of the project to the completion date of the project. In some instances, I've experienced where from waiting over a decade from the start date of a project to even the beginning of the project. And of course, in the meantime, we know that the inflation for products used in highway construction like oil and asphalt exceed far at a greater rate than the other inflation rates do. So all of this just contributes to the problem that we have of not having enough money to fund our programs. But I do think that at some point we need to look at the why it's taking us so long, from the design to the negotiation and then to the actual construction. And there certainly may be valid reasons, and I think there are some, but I think we need to look at that. And I think we need to look at the federal role in this too, through the Federal Highway Administration. Those bureaucratic requirements add to our time. But in Tennessee, in the second term of Governor Lee's term, we have appropriated billions of dollars into our rural road programs, and we haven't seen much as it was raised in a committee meeting a few months ago. We haven't seen much construction as a result of that yet. I think that is a factor that has to be looked at. Is there any way that we can streamline the construction process to take it in order to save inflationary costs? I would appreciate your looking at that. I know that's not a mandate in the bill, but I'm certainly asking you to do that.
Yeah, absolutely, Mr. Chairman, and those are excellent points, and I think that that's an area of the report that we're looking to add some more information to for the final.
All right, thank you, Dr. Lippert.
And I would add, in addition to our own work, we have also, at the request of the General Assembly, contracted with the University of Tennessee, as I've mentioned in previous meetings, and they are doing their analysis on congestion and economic effects, and which will include some recommendations that may go along with what you're suggesting that we are also going to be looking at. But that report, that analysis isn't done yet, will not be done until about the time we're completing this report, but I think it will expand upon our own work. So just want to remind the members that we also have that vein we're looking at as well.
Now, members, are there questions or comments? Senator Campbell, you lead off, and then Mayor Frank.
Thank you, Mr. Chair. I agree with you, by the way, that mutual efficiencies and operational analysis is a component of this that is crucial, because I noticed that TDOT was actually employing just-in-time delivery. That wasn't the nomenclature, but it was something along the lines of, when I was in business school, we called it just-in-time, but it basically meant that, if you're doing one thing in one place, let's take advantage of the fact that you have that operation going on to do it in another place, juxtaposed to elongating the process so it's all linear. For each process, because that can actually be a huge time saver. I just had a few questions. You ended right before we were looking at reduction, which I think is a very important component of this, because one thing that we can certainly do to improve the cost outlook of this is reduce traffic. And it's always hard to figure out what the cost benefit of those sorts of things are, but we do know that there's a huge benefit, because we have comparables with other states. A question about the mileage apportion fees that you mentioned. You indicated when you were talking about mileage apportion fees that that's already happening.
Yes, Senator. So the International Registration Plan, IRP, is a multi-state North American system that, when a truck gets a plate that says apportioned on it and travels, throughout the country for commercial purposes, they report that mileage that they travel in each state and pay portions of those states' fees to each state. So for trucks that are traveling through Tennessee, register with IRP that are crossing through the state, they're reporting mileage traveled and paying a portion of what they would pay if they were registered based in Tennessee.
Mr. Chair.
Yes, continue.
Thank you. And so my other question was, you have projections and increased revenue based on over time. So you're giving us the 2048 outlook and the next year outlook. Are you increasing that income based upon inflation or growth?
So the projections include a combination of all things. We've got population projection, population growth that's going to go up. We've got things like travel, fuel usage. So the effects of fewer gas-powered vehicles, more fuel-efficient vehicles over time is factored into, where our projections for fuel tax revenue are going to be. So we tried to combine as many variables as possible and get as best of a projection one can get for, this far out into the future, of course.
If you could I think if you told your question, Senator, I believe, can we let Senator Love and Mayor Frank are waiting, then we'll come back to you. Is that all right, ma'am? Representative Love. Okay, I thought you, Mayor Frank? Mayor Frank said, if you'd like to continue, go ahead and finish up. Let this be your question, last question,
Thank
Senator,
you.
for now.
Just one more question. I'd be remiss if I didn't talk about other options that are a little bit outside of the box here. Certainly pot for potholes, which is a huge source of revenue that we could look at. Tolls, it didn't look to me like we were talking about tolls much. And then I just wanted to reemphasize that reduction is something that I think would be a great thing to look into. Thank you, Mr. Speaker, Mr. Chair.
Mayor Frank, you're next. You're up.
Yes, when you talk about, I agree with the idea that strategic debt can be a help. When you were defining that or looking at that, you use the term construction, and I know that you separated in the report planning and development and all of the phases. When you're talking about borrowing, are you talking about strictly for the actual construction process? And I ask that because, to Senator Yeager, Chairman Yeager's point, I mean, these projects are very long and you wouldn't want to be carrying debt on the whole particular project, but it would make sense maybe on the hard construction cost phase when you're actually up and running.
Thank you for the question. And yes, so that's kind of where we say, we're giving an example of how it could work generally and pointing out that timing and how exactly that kind of financing would work would be, project specific, something that would need to really be looked at on a case by case basis. We have like a kind of a simplified example, page 67, table 14, where we pulled a few projects from the public infrastructure needs inventory that had been in the inventory for a number of years, and estimated what their cost, how much those costs have increased in that time. But yeah, to your point of, the way we constructed the example for borrowing was to spread those issuances out, not just borrow $10 billion all at one lump sum and sit there and pay for it. How that would work and how it would be spread out over time would be, dependent upon what those projects, what has been determined to be a beneficial use in a situation, in a case where doing that borrowing makes sense.
Okay. And then just one quick follow-up, Mr. Chairman.
Yes.
If that were something, that the legislature and the governor looked at doing, you mentioned in the summary pages that for debt, if I think you used the words, if exercised judiciously, you use the word judiciously. Would you feel comfortable making some recommendations for what that judicious use of debt would be? Like, for instance, a ratio of debt. I mean, you could see, and we've seen this in other states, it can get quickly out of hand. So would you be comfortable with some recommendations like a ratio limit or, some rules or regs to prevent diversion of funds to other projects? Or I don't know. I don't know what that would look like, but I just thought I would throw that out there.
No, thank you for that. And so the judiciously language comes from the report that we cited. And so there are currently, there are existing laws governing how much debt could be taken on, things of that nature. So that's something we could provide a little bit more information about those existing rules in the final report. But yeah, to look at, we looked at, these, our peer states and sort of what the debt limit, feasibly, what the potential debt limit could be that could be serviced within given guidelines, so.
Senator Briggs, you're recognized.
Yeah, thank you, Mr. Chairman. The question I have was very much related to what the mayor just asked. And Dr. Lippard, you mentioned a few minutes ago that we're in collaboration with the Haslam School at the University of Tennessee on this. And what I was really wondering, and we're all concerned here in Tennessee about our about our bond rating. We're a AAA plus, and just a personal opinion, a AAA plus bond rating really doesn't do you much good unless you're actually borrowing money. And they're with this new AI stuff that's coming online, and by the way, the newest school, not department, newest school at the University of Tennessee, and I may not get the name exactly right, but it's Emerging Technologies and Collaborative Studies, is that there should be a way of putting all of the data into a formula to know how much bond debt we can take on without adversely affecting the bond rating, which still is very important to us. And then I think a second point that you made is very, very good. It seems, I'm on the Transportation Committee, just like Senator Campbell is, and some of the briefings that we're getting continually talk about how the cost of construction is escalating even faster than inflation. So even if we tried to meet all of those needs by raising our revenue with inflation, we're going to get farther and farther behind. And I do want to emphasize a very good point you made. It's almost like the sooner we get these projects on the road, we're buying the stuff, we're getting them built. Is it really in the long run? You got a very good graph here or a very good table there that shows that. And I think that's something we're going to have that the state consider. We need to judiciously borrow money, but it's hard to come up with what that means, but I bet we can get an answer from UT. And secondly, I think the sooner we do it, the better. And we may pay a slight premium of a couple of % to service that debt. But on the other hand, we're getting it done quicker, and we're giving a better lifestyle really to our citizens. And it may even make the business atmosphere better if people can move stuff through our state quicker. But thank you, Mr. Chairman.
If I may just say, I appreciate those comments, and that I think something that I don't think I communicated, but was, those construction costs, the volatility is wild. So where it could go up, we saw after coming out of 2020, 2021, 10, 12%, huge, and then flatten back out. And so, the locking in some certainty is something that financing, getting something done sooner, because costs may not go up a lot, or you may experience a spike that we've had recently where things are, doubling over the space of a few years. So I think that's something I want to consider making sure is in here for the final.
Thank you. And I apologize to Representative Love by omitting him a moment ago. So you're recognized, sir. Thank you.
All right, can you hear me now?
Yes,
Terry Tempest Williams says that the eyes of the future are looking back at us, and they are praying that we would see beyond our time. With that in mind, we talk about the increase in what I see in Nashville with the Waymo driverless vehicles. What's it look like with the possible increase of those vehicles, which would give more people more opportunities possibly to have transportation that might not use rideshare right now, but would find maybe Waymo and other rideshare opportunities with driverless vehicles more convenient because the price point may be lower. I'm not sure what it's going to be like right now. And does that increase the number of persons on our streets and highways? Does it also then increase the wear on our infrastructure? And what role does that play in potential tax? Because the operators of a driverless vehicle may be willing to pay a higher tax because they're not having to then pay the driver, right? And then they are able to offset the cost with that. So just something to think about. I was just picturing what that would look like. I'm dating myself now, but I'm a child of a time when a TV show came on called The Jetsons. And to watch, it's amazing, but still, to watch that come into almost reality now. But there's a cost to it, right? And what's that look like? And I think part of our task always as lawmakers and executives is to think beyond our time, to think about as we legislate, what's it look like if we put these things in place, or if we don't put them in place, what's it look like if we don't now act beyond our time to see what is coming. And so I just want to put that out there. Don't want to increase your workload, but just I thought about it as I've seen so many of these vehicles now in the process of getting ready to map out more streets and working on all the kinks. What's it look like if those vehicles, well, when they come online, not if they do, but when they come online in more frequency. So thank you.
I appreciate that, and I think it's something to go back and look at the other states that have the rideshare taxes, and you know, I'm sure they're making sure that they capture something from, you know, that they're treated the same as somebody driving an Uber, for example. Our attempt to project revenue from a rideshare fee was probably the most wildly variable, you know, thing we've got in here. We have a good idea of how many people are going to drive cars and how much they're going to drive them and stuff. But if, you know, you get to a point where everybody, you know, 90% of the people in Tennessee are using rideshare 10 times a week, like that's, you know, if you just start taking the line and drawing it straight up, you know, that's not going to happen. But what, you know, so, you know, to your point of getting something in place to start capturing something from that is putting more cars on the road, and that there is some of the research we looked at that, you know, indicates that you've got people driving around looking to pick people up for rides that wouldn't be out there driving, you know, if they weren't performing that service. So it does contribute, and, you know, is something that we're trying to get as much of that information in here as possible. So I appreciate the comments.
Mayor Brown.
Thank you, Mr. Chairman. Thank you, Mr. Mario, for the report. There was a lot that went into that, and it was so far very, very good. A couple of comments and then one question. One, I wanted to mention I do think and I do believe that TDOT is working on project delivery timelines so that they can expedite more so. I think it was at the presentation that we had here, but I think an illustration of the impacts of inflation would be valuable to have within this. I think there was someone talking about, perhaps from TDOT, about how a data point I hadn't heard about the cost of guardrail and how much it had gone up substantially, and maybe look at some of the I'm sorry, not the Empower, but the Improve Act projects and what their estimated cost was versus what they are now. Because I think a lot of the political resistance to some of the proposed funding strategies is going to come from people thinking that if we don't invest in roads, we won't grow. And they don't understand that, the cost has gone, or that we have been irresponsible in some way. But the cost has truly, truly gone up. And between the construction costs and the components costs, it is, I think you said that the inflation is really outpaced in this sector all of the other inflation that we've experienced. I appreciate the borrowing strategy very, very much. I do think, further parameters about what percentage of capacity we should consider as a state. I did think that the autonomous rides fell under the ride share, but I'm not really certain about that. And then the one thing that I did want to ask was, and I thought I'd asked this before, but I may have just thought it, about parking fees. You have all the license plate readers that read all of everywhere that you park, and I don't think that's a revenue source that will grow. I think it will shrink over time, but I think if there was some ability to tax that in some way, and now also, it's crossed my mind, I'll just put this out there for, I guess, brainstorming purposes, is that especially when your fees are related to your license plate readers, you could eliminate local residents from that, but you could still charge visitors. You could eliminate Tennessee resident vehicles versus out-of-state vehicles. But anyway, that was just a thought on that I wanted to offer. Thank you.
Thank you. Are there other comments or questions? Representative Williams, and then Mary, okay. Representative, and then the mayor.
Thank you. Thank you for the report. I just had a couple of thoughts. I'm in the construction business, so over the last decade, you've seen the cost of construction go up about 47% in total. General Services 5 or 6 years ago started to add 41% to their estimates because we kept missing projections on state building commission projects. But what I found over the same period of time, that the cost to deliver a road and the ancillary projects or components of the road, whether it be right of way or reinforced concrete pipe or paving or aggregate, has gone up more than 110%. And until we can look at all the different methods of funding, and which I think are important to do, which you've done a phenomenal job at. But I do think we need to do a deep dive into finding out why the cost is so much more. I know when you look at labor rates in the construction business, they have increased pretty normally, but the labor cost for road builders has tripled what it costs to deliver a road. Why is that? If we don't answer the question of cost, we're never going to get ahead of the curve. We can't tax our way out of this situation. Your graph shows that. I do think one of the things that was considered, albeit not supported by many in the General Assembly this year, is there are mechanisms by which we can fund road projects using non-recurring money instead of recurring money. For instance, because a majority, almost half of our monies generated for the state are non-recurring revenues. We spent a little over $1.6 billion in non-recurring money on things in the legislature. If we were to earmark some non-recurring money to the road fund for a short period of time, just out of interest earnings, instead of spending it on other things, these were the monies that portions of the money that we spent in the $4 billion in the last 5 years. So there was a bill this year that allowed for a percentage of interest earnings to be directed towards the general fund, which, and of course, these are monies that are unpredictable in the short term, but in the long term, they build over time. And I think if we don't look at all the different aspects instead of just recurring revenue, we're never going to get ahead of the game. I do think also one thing to consider is the triggering point. If you were, I'm not a fan of borrowing money to build roads, but the triggering point of when that bond is issued. Obviously, you're not paying interest on bonds until they're deployed. If you were to issue bonds early in the project, as was discussed earlier, you could utilize those revenues to do right-of-way acquisition as well, which is a lot of times is the biggest impediment to the duration of time, which you may pay a little more upfront, but it might help. But I think those are some things that you and your department, UT, can consider as it relates to cost going forward. But I think the biggest lever we have is to try to figure out why it's costing so much, because we're outpacing dramatically what every other industry in the state is doing, from healthcare to education, and thus, thank you.
Yes, Mayor Waters.
Thank you, Mr. Chairman. Just a couple of quick questions. One of them is, and it may be in here, the percentage of the gas tax collected Tennessee residents versus non-Tennessee residents. Do you have that? And it may be in here and I just missed it.
Mr. Mayor, it is not, and it's getting that split of mileage and what's paid for in-state and out-of-state has been tricky to pin down. It's something that is on my list of trying to get some more information about. That's where we kind of just said things like some portions of this would be borne by those traveling from out of state, but not being able to pin it down has been tricky.
Right, and I understand that. Like in Sevier County, it would be a high percentage visitors paying gas tax versus our local residents. The other thing is, we have partnered with TDOT on some projects, local government paying a percentage of those projects to get TDOT to move those projects up in their priority list because they're so important to our area, not just for the visitors, but also for our residents. And I don't know if you've considered that. That's a program TDOT has that local governments can participate in, and we put more money, I think, as a percentage of our tax rate into our highway department than almost any. We put property taxes into our highway department because of the importance of roads in our area. But we do partner with TDOT. I don't know if you, and I know several communities are doing that.
I believe Representative Crawford, you're recognized.
Thank you, Mr. Chairman. And I'm going to kind of ask a question, but make a statement together. On TDOT's defense, in your study, have you taken into consideration, like where we had the natural disaster in Northeast Tennessee, they really stepped up to the plate and was building bridges and roads and that kind of, so it kind of got pushed in front of some other things. Is that being considered in your report?
Thank you. I don't know if it specifically we've mentioned it. I know it's come across the research and the conversations we've been having, and as to what portion of some of these projects that are currently under construction and being delivered came out of that. But it was something that put a stress on the state financially. Getting federal aid, where all the pieces that had to go into that is certainly something that having some flexibility to be able to do so seems like it was important.
Second thing is, the people I represent is more of a rural area. We're not a Nashville, Chattanooga, or Memphis, But the locals, when you're looking at the revenue projections and what they are paying out and what is being given back to them, I would encourage you to make sure that there was a voice from the smaller communities, cities and counties that could put their 2 cents into when you take that into consideration. Thank you. Thank you, Mr. Chairman.
Thank you. Executive Huffman, you're recognized.
Thank you, Mr. Chairman. And Bob, thanks to you and your folks for this report. There is a lot in here. I know this is a lot of work, so thank you for that. Just one scenario regarding the bond indebtedness. You know, if the federal government ever really gets serious about reducing federal debt, when they've looked at it in the past, they always talk about, you know, taking the tax exemption off of municipal bonds. If that were to happen, if the federal government removed the exemption on bonds and you had to pay taxes on the interest of those bonds when you issued them, that's gonna increase the cost of issuance substantially. In your opinion, based on what you've seen in these reports, would that eliminate the need or the justification to issue bonded indebtedness if those bonds are no longer tax exempt? Would that level the field to the point that you wouldn't be saving a whole lot between inflation and interest costs?
I appreciate the question. I don't remember coming across any research that looks at what that potential effect would be. It was kind of beyond, you know, that I think we're hoping that, you know, for scenarios to consider whether that's a good option, you know, that that exemption remains in, you know,
Yeah,
makes these an attractive investment for people to use.
Yeah, and if that were a serious issue, if it were really being debated, you can expect a flurry, I suspect, of tax exempt bonded indebtedness coming, trying to get ahead of the new legislation, and that might drive up the cost as well. But that's all I have.
Thanks, sir. Representative Williams and then Commissioner Bryson. Representative, you're recognized.
Thank you. I did want to also meant to comment. Commissioner Reed, TDOT, there was some discussion earlier in the year about the Federal Highway Transportation Safety Funds and the formulary in which they generate in order to do that. I don't think it's been changed in a long time. And he was gonna, he had a meeting in DC, I think in March or April of this year, with the premise behind trying to change. Of course, we've added 500,000 or 600,000 new citizens in the state of Tennessee, and we're still getting funded based upon where it was 15, 20 years ago. And so, did your formulary impact any growth from the federal government? It looked like it did, but I didn't know if it was CPI adjusted growth, or was it an actual change to the formulary that reflected what might be new or more revenues from federal government?
No, yeah, our assumption, I think it says in there somewhere of, you know, assumptions are that existing federal programs would continue to operate the way that they currently do. And the long-term projections were that the increase from IIJA would get spent down. And if they return back to that, you know, pre-IIJA level, that's kind of where we took our shoot from there. So we didn't consider possibilities of how appropriations might be changed in.
Might be worth just to reach out to TDOT again, ask how the meeting went, see if what their optimism level is as it relates to their discussion with the Fed regarding those funds. I think obviously, as I said before, we're not going to be able to tax our way out of this, but if we were to get a more fair allocation of revenues from the federal government as it relates to our roads, with so many interstates bisecting our state, I think it's incumbent upon us to try to find a way to get more revenue and contact our congressional or federal delegation to see that they are advocating in the same fashion. Thank you.
Commissioner.
Yeah, thank you very much. Yeah, I really appreciate the report and the fact that you've looked at a lot of different things. I don't think there's a silver bullet. There's probably going to be several things that will need to be done. And that kind of leads to my comment. I really like Chairman Williams' question about expenses and why they've gone up so much. We know there's been a lot of increase in construction costs, but it'd be really interesting to know if highway construction costs have increased significantly more than other construction costs, and if they have, why? What is that? I think that's a really interesting question. Also wanted to pick up on the comment that was made about the change in TDOT's, the way that TDOT manages their projects. I think they've changed that pretty significantly over the last few years. And what I don't really know is, I know they have there's a big backlog of projects. What I don't really know is how that affects that backlog and the cost of that backlog, because finishing those projects more quickly should reduce the overall cost of those projects. I don't know how that impacts things, or how it impacts some of these scenarios or other things that we do. And I think we need to make sure that we're looking at the way the projects are managed now versus the way they might have been managed 10 years ago. That'd be very helpful. The other piece is, I don't see anything in here about cost shifting types of strategies like the choice lanes, public-private partnerships and those types of things. And I just wonder if that's come into your analysis, or if that's part of the solution, where we're taking funds that we would have had to spend here, but because we can do a public-private partnership, those funds can now be moved maybe to an area where that is not a possibility, rural area or other things. Is that something you plan to address in your report?
So I appreciate the questions. I think, our discussion of the public-private partnerships as sort of a general an option, if you can get it, if you can find the right investors for the right project, is about as far as we've done with that so far. As to how it might affect changes in the overall backlog and shift funds around, we have not looked at applying sort of a hypothetical, if there were this many things done through public-private partnerships, freeing up this amount of money, what would that do? So that is possibly something we could try to model and illustrate, like we've done with some of these other scenarios.
Yeah, and I don't know, of the 30 billion or so that's in our backlog, I don't know how much of that would be potentially a possible public-private partnership. But when we do one of those, typically we're talking about billions of dollars, not so it's usually a big shift if we can do that, and it's something I think we need to look at.
Are there other questions? Dr. Lippard?
Just a few comments, and I will say, when we did talk about the public-private partnerships in the draft report, we actually also talked about it in the context of the strategic borrowing, where we talked about you maybe consider judicious borrowing for projects that aren't good candidates for public-private partnerships. So we've talked about it in a general sense, but I think Bob's right. We could probably do more developed scenarios on that. And on the costs side of transportation, what's driving the increase in costs, I think that's something we should probably right after this meeting or shortly after this meeting, reach out to our partners at UT Center for Transportation Research who are doing the additional analysis on this, because I imagine they've already taken a look at that and can probably provide us some information that we can get to the members pretty quickly.
Are there other questions or comments? Good. I believe that this is a draft report and does not require approval, but I want to, on behalf of the members, I want to thank you for a very, very thoughtful and substantive report. It was very useful, and I also want its thoughtfulness and its intellectual power is matched only by the questions and comments we received from the members here today. There were some really good questions and comments, so thank you for that too. We appreciate it. This would.
Thank you, Mr. Chairman.
Okay, we have one more item on our calendar, I believe. Tab 8, Public Chapter 413, Acts 2025, the Ambulance Services Draft Report. Actually, excuse me, as Dr. Lippard has shown me the second page. There's we're getting to we're not, I got all excited for naught. I thought we were at the last one. We still have a couple more to go, but we'll breeze through those, so to speak. But I think this would probably be a good time for me, because I'm not sure how long the ambulance report will last, but I'm going to have to excuse myself from the meeting because of a prior out-of-state obligation that I have to go catch a plane to meet, and not too in just another hour or so. So I'm going to have to leave the meeting now, but in absence of our vice chairman, I have asked Mayor Frank to serve as our temporary chairman for the purpose of conducting the meeting today. And she's graciously consented to do that. And unless there's an objection to that, then I will turn the meeting over to her so that I won't have to leave in the middle of the next report. Is there any objection there? Of course, there being none. Mayor Frank, here's the gavel. But now I want this gavel back. Okay. Thank you very much.
All right, go ahead.
Well, thank you, and good morning, Commissioners. My name is Nathaniel Pettit, and I'm a research associate with the Commission, and today I'm presenting the draft of the Commission's report on required ambulance services in Tennessee. Public Chapter 413, Acts of 2025, directed the Commission to study the economic impact on counties that are required to provide ambulance services, which counties provide services directly or franchise those services, which municipalities provide ambulance services, and whether policy changes may benefit the overall health and delivery of ambulance services in the state. Additionally, the Act directed the Commission to study emergency and non-emergency transport, reimbursement including from commercial payers, Medicare, Medicaid, and the way counties and municipalities fund the deficit at which these services operate. To do so, Commission staff interviewed nearly 100 stakeholders, requested and analyzed data from several state departments, and reviewed literature from ambulance-specific and related sources. Additionally, Commission staff recently received further data from TennCare that we will continue to analyze and integrate into the final report where appropriate. Tennessee designated ambulance services as essential in 2021, making counties responsible for ensuring that at least one licensed ambulance service is operating in their county. All 95 counties follow that rule, providing ambulance service either directly or indirectly. Currently, 63 counties provide ambulance services directly. 3 use their county hospital, and 60 use a non-hospital service. The remaining 32 counties provide their service via agreement with a third party, either another government entity, a for-profit organization, or a nonprofit organization. Commission staff created a table categorizing counties based on how they provide their service, among other factors, available on page 14 of the draft report. Excluding counties with extreme values or no data, counties' average expenditures for ambulance services increased from $1.8 million in fiscal year 2020 to 21 to $2.7 million in fiscal year 2023 to 24. Average revenue, expenditures, and the average deficit are represented in Table 2 on page 18 of the draft report. A recently proposed rule by the Center for Medicare and Medicaid Services that caps TennCare payments may put further pressure on county budgets as it could potentially reduce ambulance service revenue. While counties are responsible for ensuring ambulance services are available in the county, cities contribute to emergency service in their areas in a few different ways. 11 cities fund their own ambulance services, while others voluntarily assist their county's ambulance service. This assistance may come directly via funding agreements or via in-kind contributions, like having their fire department respond to emergency medical calls, or by collaborating to build a county ambulance bay on city-owned property. The original version of the bill that became our study would have required a municipality that does not provide ambulance service to reimburse the county in proportion to the percentage of the county's population housed within the city, up to 50% of the ambulance service's total cost. Stakeholders say that city residents already help fund county ambulance services through their county taxes, and the bill could have the unintended consequence of cities starting their own ambulance services, resulting in counties paying more to provide service in outlying unincorporated areas. For these reasons, and because of voluntary cooperative arrangements many cities and counties have already adopted, the Commission does not recommend Senate Bill 160 and House Bill 83 as originally filed, but instead encourages counties and cities to continue exploring mutually beneficial avenues to share costs and improve ambulance services. Other alternatives to the original bill exist. Equipment costs are the third largest cost category for ambulance services nationally. The General Assembly has funded ambulance equipment grants over some of the past few years, but the grants are not recurring. There are recurring grants for other state-required county services like emergency management, law enforcement, roads and bridges, solid waste, and stormwater. Changing the equipment grant from non-recurring to recurring could help ambulance services better plan for needed equipment purchases. For these reasons, the Commission recommends the General Assembly make funding for the equipment grant recurring. Labor costs are the largest cost category for ambulance services nationally. In addition to programs offered through dual enrollment, and training opportunities at the state's colleges, there are also 30 training centers operated by ambulance services, which provide training for emergency medical technicians and advanced emergency medical technicians. State law restricts the number of training centers to 30, but representatives of ambulance services say more training centers would help address staffing issues and that the statutory cap should be removed or increased. Other alternatives to the original bill that could help address the rising cost of ambulance services include contracting with third-party billing companies to increase collections, expanding non-emergency transport, sharing medical directors, and increasing revenue by filing claims with the TNT2 program. Although these alternatives may not be appropriate for all ambulance services, the Commission encourages ambulance services to explore opportunities for increasing revenue and reducing costs of their operations. With that, I'm happy to take any questions on the draft report. Thank you.
Thank you, Nathaniel. Any questions for Nathaniel? Yes, Mr. Peach.
I just want to say, number one, I appreciate, Ms. Pettit, all your work on this. This was one of the studies that I was very interested in, mainly because of the issue of the double taxation. I felt this was for Rutherford or county residents that reside within the cities, and that there was not one difference in the type of service that they're providing. So I felt like that was a problem, as well as I don't like seeing the counties and the cities pitted against each other either. So I think it works best when they work together. So I do appreciate some of the recommendations in this report.
Any other questions? Yes, Dr. Lippert.
And Nathaniel, you may have mentioned it and I may have missed it, but just so the members know, there is some additional data that we've gained access to since the draft was developed. So we're going to be adding a little bit even more data to the report. It won't change any of our recommendations, but it'll just provide more information. So you'll see that in the final report.
Thank you, Dr. Lippert. Any other questions? With that, I do have a couple. So on page 24 of your report, you do make note of the issue with TennCare and Medicare's base reimbursement rates, and you note that they are too low. You get into some of the reasons why, and these are regulated at the federal level without states' input, but you come short of making any kind of recommendation. So I just would kind of like to put that out there and ask maybe why, or even if it was just a recommendation that the state look closer at that issue in some capacity. You know, the citizens expect when they dial 911 that someone is going to respond, and the state does have an interest in increasing the requirements, the training. It's being, monitored more and more. This is an industry that started out as the funeral homes transporting people as quickly as they could from point A to point B. And really the industry has advanced rapidly in that a lot of them are now mobile ERs, and that's the community's expectation. And then also just the model itself is a transportation-based model. I think under the new rural health, I can't remember the acronym of what it's called. Tennessee just was an award recipient for some rural health development dollars. And I think they're looking at maybe some opportunities there to test the waters with some maybe pilot programs, community paramedicine, mobile health delivery of services. But maybe there's something that could, even just be added there about that is a way to look at more revenues. Because you do kind of wrap it up by saying EMS, the system should continue to look for more revenue. Well, some of that's going to have some legislation or some federal changes or some state changes to be able to allow that to happen. So.
Sure, and thank you for both the
Yeah.
questions. To start with the reimbursement portion of the report, you're correct that we do stop short of specific recommendation in that area. I'll kind of outline our thinking or walk up to our thinking in that, you're right that there's a few different payers. There are the private insurers who present their own problems to regulate, and the Medicare rates that are managed at the federal level. And then there are the Medicaid TennCare rates that are under the state's control. And we studied those very closely and modeled a few different recommendations in that area. Shortly before this meeting, about the middle of the month of May, CMS put out a new proposed rule that will limit state-directed payments to 110% of the Medicare rate. And Tennessee's rates, and this discussion mostly happens on pages 26 and 27. We kind of get into specific numbers about why Tennessee's rates will have to come down. So rather than try and force a recommendation in that area coming off of that new rule, we've been in constant contact with TennCare, trying to work through exactly what that change will mean for them, if there are alternatives that exist in that area, and if not, what other areas we would need to look at to make a reimbursement change. You're right that they do fall short of covering the cost of providing transport. Right now, Tennessee services are a bit fortunate in that, depending on how you look at it, in that TennCare will pay somewhere between 112 to 130% of the Medicare rate, but that's still not enough. And so, without getting to an actual recommendation, we wanted to outline those factors and point out that they are very real and affecting ambulance services. And we'll continue to talk to TennCare about what they plan to do with that new rule and see if anything is born out of those conversations. You mentioned the Rural Health Transformation Program, which does have a couple of things which are going to be helpful for ambulance services. I think my understanding is that either currently or soon, the process for applying for grants for new ambulances in rural areas will open, which, as the Rolling Stock report has covered, and we heard throughout the study of this report, the vehicles are difficult to come by, and so I think those will help. And then there are those at home or non-transport or transport to alternate destination opportunities that do exist. Tennessee has a program now that's the TNT2 program that will reimburse ambulance services for providing either treatment in place or transport to an alternate destination like a mental health clinic. About 50% of ambulance service providers filed a claim under that program last year. We talked a lot to TennCare about that program, and what we've heard from them recently as yesterday, is that they're working with the Tennessee Ambulance Services Association to kind of look at how they can improve that program and get participation up. So rather than step on the toes of something that they were working on now, we're seeing how those conversations go. And if when we talk to them after those conversations occur, they feel like they could use a recommendation, that's something that we would evaluate putting into the final report.
Thank you so much.
Of course, yeah.
Anything else? All right, thank you. Next, yes, Public Chapter 341, Michael Mount, Acts of 2023.
Thank you, Chairman. Commissioners, my name is Michael Mount. I'll be presenting our periodic report on collections and administration of Tennessee's business personal property tax. To file and pay the tax, businesses across Tennessee must account for all of their personal property, things like office supplies, equipment, etc. Both businesses and local officials say that filing, paying, and collecting personal property taxes can be burdensome, often for minimal amounts of tax. To reduce the burden, Tennessee has long allowed businesses with $1,000 or less in personal property to pay the tax at that $1,000 level of property value rather than itemizing their property value, personal property. To give more businesses that option, the General Assembly adopted a commission recommendation and enacted Public Chapter 341, Acts of 2023, to replace the $1,000 threshold with $2,000 and $10,000 thresholds. This update went This update follows the first year that the new thresholds went into effect, which was 2025. No additional legislative changes are recommended in this update, but staff will continue to monitor the Act's effects. With the caveat that the data does not differentiate between taxpayers who itemize returns and that happen to have exactly $2,000 or $10,000 in personal property, and those that chose to forego itemizing. The data shows that more businesses reported personal property at the $2,000 or $10,000 tiers in 2025 than reported at the $1,000 tier in previous years. And you can see that in the figure in the memo. This is not surprising because the number of eligible businesses increased from nearly 35,000 to nearly 151,000, which is about half of the businesses in Tennessee. Though the percentage of eligible businesses reporting at one of the tiers decreased. Representatives of businesses have been generally supportive of this change, saying that more businesses can now avoid paying CPA amounts that can exceed the amount of tax owed. And taxpayers were reportedly happy about the time that they saved filling out the tax returns. Local officials reported that the act had little effect on their staff, though most assessors said that the new tiers didn't change the cost of the assessment or that the changes to cost were hard to quantify. Though one said that their staff time increased to help taxpayers who were confused by the new tiers. Another assessor said that some taxpayers didn't understand that when they were selecting a tier, that they were also selecting their assessment, and then they were needlessly filling out their personal property reporting schedule. A third suggested that adding details to the instructions on the reporting schedule could reduce confusion. Assessors contacted by TACIR staff were frustrated with the large number of businesses that failed to file, which has increased from year to year. And trustees didn't report any significant trend or change in collections or delinquencies, either because of the tier or otherwise. They said that pursuing what are small delinquent tax bills continue to cost them more than the amount billed, and suggested that exempting very small bills or having a minimum bill would make more sense. However, the state constitution prevents that. And with that, I'd be happy to take any questions.
Thank you, Director Mount. Any questions for Director Mount? All right, hearing none. Thank you so much. And we will close out the day with Ismail Tanwi with the fiscal capacity report for fiscal year 26-27.
Thank you, Chairman, Commissioners. I'm Ismail Tanwi, Research Associate with the Commission, and I'll be presenting our annual report on fiscal capacity. I would like to start by providing a brief overview of TACIR, that is the Tennessee Investment in Student Achievement Funding Formula. It has 4 components, and of which 4 components, 2 use our fiscal capacity index, that is the base and the weight funding amounts. The base funding amount is a fixed dollar amount of funding per student, which for fiscal year 2026-27 has been set to $7,500 per student. Weighted funding is calculated based on a percentage of the base funding amounts for students that meet the criteria set in the state law. The local share of the base and the weight funding is allocated to the counties based on their fiscal capacities. The fiscal capacity is calculated by taking an average of the TACIR and CIPA models. CIPA model is produced by the University of Tennessee. The other 2 components, direct and outcome funding, are 100% funded by the state, and they are not equalized. Fiscal capacity answers the question how much each local government must contribute and is done by measuring the potential ability of local governments to fund education from their own taxable sources relative to their cost of providing services. It is a county-level model, which means all school systems within a county are treated as if they have the same fiscal capacity. To calculate fiscal capacity, a set of averages drawn from actual taxpayers' income and other variables are compared to the actual revenue. The amount of weight to give each variable is determined by estimating the statistical relationship between them. We use actual revenue as a control variable that keeps the estimates within the bounds of what local governments actually do. The method for calculating TACIR's model is multiple regression analysis, which is a commonly used method for understanding relationships among factors and determining how much weight to give each variable. Multiple linear regression analysis simultaneously compares all variables for all counties to determine how much weight to give each variable. These weights are multiplied by the variables for each county to estimate potential local revenue for each of the 95 counties. To show the relationship between fiscal capacity and some of the specific variables, other things being equal, from this table, when taxpayers or per capita income increases, we expect to see fiscal capacity increase as well. In contrast, when the tax burden or service burden variable increases, we expect counties' fiscal capacity to decrease. We are going to discuss these variables in detail in the next few slides. We'll begin by the on-source revenue per student. This is the actual amount of money local governments actually raise to fund their schools divided by enrollment, which is the average daily membership. This is a control variable that keeps the estimates within the bounds of what local governments actually do. The next variable is the per capita income, and it acts as a proxy for county residents' ability to pay for education and for all other local revenue not accounted for by the property or sales tax. We also have the sales tax based per student and equalized property assessment. These are the tax-based variables. The other two variables is the equalized residential and farm assessment divided by the total equalized assessment. In the TACIR model, equalized residential and farm assessment divided by the total equalized assessment estimates a county's potential ability to expose taxes through business activity. The service responsibility is measured by dividing the total number of students in public schools by the entire population. The larger the number of public school students per 100 residents, the greater the fiscal capacity, the fiscal burden for each taxpayer. An important thing to remember is that a county's share of statewide fiscal capacity depends on both the county's growth in fiscal capacity and the growth of the other 94 counties. This map shows us the long-term fiscal capacity trends by county. Fiscal capacity sums to 100%, so if one county increases, another must decrease. In this map, the pale yellow counties are keeping pace with the state's overall growth in fiscal capacity. The green counties are growing faster, and the blue counties are not keeping pace with the state. And that marks the end of the presentation, and I would be happy to take any questions. Thank you.
Any questions? Director Lippert.
Thank you, Ismail. I just would add, not really a question, I just wanted to make sure the members know that in your docket material, you also have the table showing the fiscal capacities for each of the counties, in addition to the presentation material.
Thank you, Dr. Lippert. Any questions for Ismail? All right, thank you so much for your presentation. Dr. Lippert, other business.
Thank you, Chairman. The only other business I have is our next meeting date, and we do have a tentative date set for September 16th in the same room. It's based largely on the availability of this room, but So what we'll be doing is April will be reaching out to you all to see if we're going to have a quorum for that day. If we're able to achieve a quorum for that date, then our next meeting will be on September 16th.
Anything else? All right, unless there is an objection, we will stand adjourned. Hearing none, we are adjourned.